So, a very good evening to everyone. I am Dr. Reshma Pujara. Can you hear me, Bhushan?
Yes, ma'am. We can.
Bhushan, can you hear me?
Yes, ma'am. Yes, ma'am.
Okay. So, I'm Dr. Reshma Pujara. I'm a consultant neonatologist at Pramukhswami Medical College, Shri Krishna Hospital, Bhaikaka University. I'm working there as an assistant professor in Department of Neonatology. And today we are going to talk about infection prevention in NICU. And our second year DM student, Dr. Bhushan Korde, is going to do the presentation. So Bhushan, you can start your presentation.
Okay. Thank you, ma'am. So topic for today's seminar is infection prevention in NICU. So for today's seminar, our learning objectives are to know about what are the hospital-acquired infections in NICU, what are the common infection control precautions, and how we what is the importance of hand hygiene, how we perform hand hygiene. And our whole motto of this seminar is to learn that the hand hygiene is the only thing which is most important to prevent infection in NICU. And there are other techniques which we use to control the infection in NICU, and some infection control precautions in NICU. Okay. So, why neonates are prone for hospital-acquired infections? So, basically, in neonates, there are different problems, such as neonate can be born with low birth weight, prematurity, congenital malformations. Then there can be an open spina bifida defect in the neonate. There can be which can lead to infections in the neonate. So congenital malformations are also important. And if there is prolonged hospital stay for the baby, if there are frequent invasive procedures, we are doing frequent invasive procedures in the neonate, those procedures prone these babies for the small newborns for the infections. Okay. So if we are using TPN like lipids, if we are using it in our NICU setups, they lead to more chances of sepsis in the newborn. So, and these newborns, as these are prematures, they have premature babies, they have immunity deficiency in them, and this makes them prone for the hospital acquired infection. So if we start delayed enteral feeding in the newborn, that can also prone the newborn for hospital acquired infections. As you all know, formula feeding is a risk factor for infection. And if we have insufficient or inadequate staff, overcrowding in the NICU, that will lead to hospital acquired infections. Okay, so and one of the major reason is hand washing. If we don't perform hand hygiene, so that will lead to infections. Okay, so most important factor is hand washing. So which are the common infection in NICU? So common infections are central line associated bloodstream infection. As you know, we care for preterm premature baby. We need to put UAC, UVC, or a PIC line. And if that PIC line is not handled with care, with care bundles and the insertion and maintenance bundle, if there is no written policy, and we are not managing the line with those bundles, so they can lead to central line associated infections, and these are very notorious infections. They are very difficult to control with antibiotics also. Okay. So, and as you know, pneumonia is very common in newborn, neonatal sepsis, and device which we are using in NICU, that those can lead to infections in newborn. So as you can see, this is the chain of infection depicted here in this picture. We all are aware of this chain of infection transmission. So to break this chain, we need to take some steps to break this chain. And if we are able to break this chain, transmission of the infectious agent will not take place, and this will effectively prevent the infection. So what are our aim of infection control? So mainly disease transmission can be prevented by breaking one or more of these links in the chain of transmission. And basic control measures include we should reduce the transmission of pathogen from known or unknown source. So basics of infection control also include policies to control the infection, procedures to be applied to prevent the spread of infection in the hospital, and prevention of hospital acquired infection is responsibility of all the individuals and service providers of the healthcare setting. So to practice good asepsis, we should know about what is dirty, what is clean, what is sterile, and how to keep them separate. So there are in the infection control precautions, there are standard precautions and transmission based precautions. Standard precautions are applied to all the patients which are admitted in the NICU. And for transmission based precautions, it is either for contact, droplet, or airborne infection. So in standard precaution, you can see here there are simple, consistent, and effective approaches to control the infections. You can see in this picture, the healthcare worker is washing their hands using hand gloves, applying mask, and using eyewear to protect from the transmission, droplet transmission, wearing a gown, and for there should be a minimal contact with blood and body fluids. So for that reason, we should always be cautious not to touch any uh, waste product which is being produced during this process, and we should keep that area where we are keeping all this. That area should also be clean and should be free from infections. So, what measures we take to prevent the contact-based uh, precautions? So, basically, most important thing is hand washing. Hand washing. You can, matlab, mostly you should always prefer hand washing. Hand washing is all most important step. And what happens in NICU if we are not washing your hands and wearing the rings in the hands, watches, our area, if you are using full sleeve shirts, these are very people, most of the people don't follow these practices. Due to these, bacteria can transmit to the newborn. So always remember, while taking care of the newborn, you should never use a ring, a bracelet, or a watch. You should always fold your shirt above your elbows, and you should always clean your hands till the elbow. In case if you are not getting in contact with the blood or body fluids of the newborn, and if you have touched a clean surface, you can use hand-based rub. That is alcohol-based rub. You can use that is uh, you can that is allowed, but always prefer to wash your hands for 40 to 60 seconds with the use of soap and water. Then when you are going to get a direct contact of the patients, means you are going to touch the baby's blood or body fluids, and while putting any UVC or doing any procedure which that at that time you should always wear a gown, and you should always wear a clothes. That you should always remember. So, how to prevent from droplet infection? Again, hand washing, hand washing, and hand washing. Hand washing is very important. I have already told the how to you have to wash your hands. In case the healthcare worker is to prevent the actually to prevent babies from getting infection from healthcare worker also, you should always wear mask, and for your own safety is also important. But in case if you have upper respiratory tract infections, or you don't know, you never know you are in you have an infection, you are not never you never know, so you have to always wear a mask. And for eye protection, you can use protective shield. For airborne infection, again, hand washing is important. You have to close the door. You should always create a barrier. There should not be a direct entry of air into the NICU. You can keep windows open if possible. And for airborne infection, you can wear N95 mask. In the era of COVID, we all know what is N95 mask. So for hand hygiene, CDC and WHO on hand hygiene, they have given certain guidelines. They always give stress on hand washing for 40 to 60 seconds with soap and water. That is the most preferable method. You can use antiseptics containing chlorhexidine and alcohol. uh, in some cases. They are active against gram positive and gram negative bacteria, including MRSA, but always go with hand wash. So there are types of hand wash such as routine hand wash. Routine hand wash is using ordinary soap and warm water for at least 40 to 60 seconds and drying your hand with disposable paper and towel. For alcohol based rub, you have to perform all the five steps while using the hand rub. The steps of hand washing should be repeated using alcohol rub. So it can be used if your hands are not visibly soiled. You can use that.
Bhushan,
Slides not moving.
slides are not moving.
Yes, yes, ma'am. Now they are moving.
Okay.
So there and again there is a antiseptic hand wash in which you have to take an adequate volume of antiseptic soap, and you should at least do a hand wash for 60 seconds and then rinse dry your hands and with a disposable water. What is surgical hand wash? It is very important to know about surgical. These types are very important. You should always know, because people, while performing important procedure, they only go wash their hands for 4 5 seconds and come again and do procedure like UVC and USC. You are probably putting a newborn into the risk of hospital acquired infection. So always remember, there are these types. You have to perform your hand wash very proper. So when you have to do your hand hygiene, so always before getting in contact with any patient, before any aseptic task, after body fluid and exposure risk, after patient contact, after contact with the patient and the surrounding. These are the things where you have to keep in mind that you have to do your hand hygiene, or at least you have to do your hand washing, or at least not possible, you have to always apply the hand rub. So these how to wash your hands, how to use rub, all these things you all very well know, and you are using it in your NICU. So so techniques used for hand washing is the clean technique, aseptic technique, sterile techniques, and these techniques should be used while by a healthcare worker, while a patient, and for the environment, and if you are touching any instrument or equipment. So, what is clean technique? Clean technique is used for routine patient care while examining a patient, taking pulse, temperature, BP, or feeding or social turn. So, in this, healthcare workers should always do a routine hand wash, use a alcohol-based scrub after the patient and before and after the patient contact. There is no need of developing barrier between healthcare worker and patient. So because patient skin is intact, so we don't need to create a barrier. And your environment should be clean, and instrument equipment should be clean and disinfected by the low level disinfectant. What is aseptic technique? In medical asepsis, a set of specific practices and procedures done under a carefully controlled condition, mostly outside the operation status. Example, while giving IM or IV injection. So healthcare workers should always use antiseptic, soap, alcohol, and always remember, I'm stressing on this point again and again, that hand wash is the only thing which is going to prevent the transfer of infection in your NICU. So this during this aseptic technique, barrier should be between the healthcare uh, worker hand and patient should be created using a gloves. You should use gloves for creating a barrier. So patient skin needs disinfection by short-acting disinfectant like alcohol, and environment should be clean and disinfected as before. So what is sterile technique? What is surgical asepsis? Usually in this, while you are inserting your umbilical line, PICC line, central line, or any kind of surgeries, basically the surface should be clean from a organism, including spores. So that is the only thing which is going to reduce your infection rate. So healthcare workers should use surgical scrub with antiseptic hand wash and solution. There should be a barrier between healthcare worker and patient created using a sterile PPE. PPE is personal protective equipment, and patient key need to be disinfected by long-acting disinfectant like chlorhexidine or pyridine. And so aseptic precautions are always required during peripheral venous catheter insertion. If you are giving IV therapy, like preparation of IV fluids, IV fluid therapy, and for umbilical catheters or administration of any IV medication and drugs. So how to prepare for peripheral venous catheter? So always do aseptic hand wash, wear your sterile clothes, clean 5 centimeter of the skin at the site from inside outward. So this is very important. You have to clean from inside to outward. You should not again go at the same site which you have cleaned with the disinfectant. And you can use 2% chlorhexidine or 70% alcohol for with friction for at least 60 seconds. And you have to leave that area dry for 30 seconds, and do not palpate the vein or skin once it is clean. Okay. Use no touch technique. For IV therapy, use aseptic technique, establish a specific area for preparation of the medication and IV fluid. Some setups have lamellar flow. That is the ideal thing. If you have, you can prepare your IV fluids in the lamellar flow. This area should be used for store and should not be used to store or place any biological material like blood or milk formula, anything which can basically source for infection. Okay. So all prepared food should be kept in a fridge at 2 to 8 degrees Celsius. So for administration of IV, you should always follow every step. You must follow strict aseptic technique. Maintain a close system always, all the time. Do not mix the medication together. If medications are compatible with IV fluid, do the procedure. Stop the IV fluid first. Flush the cannula with saline solution. Infuse medication. Flush again. If we need to infuse the second infusion, flush again. So and or restart the routine IV. For umbilical catheter, basically umbilical catheter should not be touched on a frequent basis. Any catheter, like any central catheter, should not be touched on a very small duration. It should always be used for continuous infusions only. And if at all, if you are using, you have to always have a care bundle, like maintenance care bundle. You should always follow that care bundle to prevent the infections and therapy. If whatever you are given thrombolical line should be used given by using a maintenance bundle. So what are the precautions while infant feeding? So expression of the breast milk must be necessary when a sick infant is unable to suck. The breast milk shall be collected and stored in a aseptically, and hands shall be washed with an aseptic precaution and shall be expressed in a sterile water. Basically, the environment in which milk is being kept, that should also be clean, and all breast, if you are using breast pump, the components and all the container all should be washed with soap water and should be used and disinfected on a daily basis. Milk should not be stored in a refrigerator for more than 24 hours. So, what are the infection control precautions in NICU? So, barrier method, always use a single use gloves that are recommended during all patient contact, especially with septic neonates. Then, infant with infectious diarrhea, draining skin lesions, purulent conjunctivitis, infection with rotavirus, hepatitis A, enterovirus, care of infant with respiratory viral infections to reduce accidental self inoculation. Also, wear sterile gloves before performing invasive procedure and fluid preparation. So single-use gloves should be used and should be changed if the you are taking care of the other patient also. And for barrier precautions like gown, so a gown protects an infant from contact from the wearer's clothing and prevents contamination from the healthcare worker if affected skin and infants. Okay, so routine use does not help in decreasing the nosocomial infection rate. A gown shall be worn if the newborn is to be handled outside the incubator where the direct contact is exposed and invasive procedures are done. A single gown should be used for one baby. You should not use the same gown for one baby and the same gown for other baby. That is not going to help. It will only transmit the infection. So, single room isolation to prevent spread from communicable diseases. Newborn with documented or suspected infection with communicable or epidemiological important pathogen, there is a recommendation for a single room. It is difficult in Indian setting, but if possible, infants with mother with varicella, measles, tuberculosis, airborne infection, you should isolate this kind of newborns. Infant with infection with droplet transmission, such as mumps, meningitis, you have to do a droplet precaution. And infant with MRSA or MDR, contact precaution is very important. So, what is visitors management? Actually, there should not be any visiting time in NIC. Visitor, this link will expire in 10 minutes. So, I have shared second link. If this link expire, you should join the second link. And visitors should be treated on an individual basis. The if babies are to be shown to the family, we can use a viewing box from where the families can see the baby. Only parents can be allowed if after doing hand hygiene protocol, parents can come in. So for staff, adequate staff is mandatory to allow for hand washing between the patient. Staff is very important, and staff ratio is one professional nurse to every 6 to 8 infants in a normal nursery. In intermediate care nursery, staff ratio should be 1:2 to 3 patient, and in NICU where intensive care has to be delivered, so one professional nurse has to 1 to 2 patient must be there. So for linen handling, so ensure that linen handling policies are adhered and prevent for cross infection. Enough clean linen must be available. Soiled linen should be discarded. Nappy changes should be done wearing a disposable rubber gloves. That is very important. General housekeeping, then cleaning should be followed in patient area. Areas should be this this area should also be clean, and it should be dry dusting should be avoided, and sink to be cleaned with detergent at least once a day, and cabinet counter should be cleaned at least once. So for waste disposal, handling and processing of the infectious waste must be placed in colored coded leakage proof bags collected with barrier precautions like gloves. Soil diapers and medical waste should be collected for 3 to 6 hourly. Proper disposal of sharps should be practiced to prevent a needle stick injury. So in neonatal unit, personnel allotted to work in neonatal should be immune to rubella, measles, polio, chickenpox, hepatitis B virus, and influenza vaccination should be offered. Proper PPE should be readily available for use when blood splashes and body fluid spillage are anticipated. Infection safety and sharp disposal should be practiced to prevent the needle stick injury. So, fumigation. So, there are no additional benefits of fumigation. If excellent housekeeping and asepsis is there is no need to do regular fumigation. So, how to detect? So, culture of the environment specimen, you have to tap water sample, seeing trains, liquid medication, respiratory therapy equipments, hand soap and hand cream, water bath used to warm the formula, dry and moist environment surfaces were soaked with a cotton swab, hand swabs from the healthcare workers. It should be processed within. So, what is the take home message? Take home message is all the neonatal care unit staff shall be familiar with the infection control practices that minimize the infection risk in the staff and the patient. Strict hand hygiene compliance according to WHO 5 hand hygiene method should be followed. Invasive procedures shall be used cautiously and with appropriate and aseptic technique. Handling of the unit shall be minimized. Equipment and supplies should not be shared between the infants, and there should be a proper visitor management. Thank you.
So, Bhushan, there are a few questions in the chat box. So let me see how much time we have.
5 minutes, ma'am,
eh,
mostly.
So we can try and answer those questions, and then if the link expires and if we are not able to finish, we can all join in the second link. Okay.
Yes, ma'am. Yes, ma'am.
So the first question, there was one person has mentioned that there is no evidence for scrubbing to reduce
Yes,
infection.
yes,
So
ma'am.
I've already answered that.
Yes,
It's
ma'am.
true, as you already mentioned, and we all know that nowadays we don't routinely wear cap, mask, or gowns while entering in the NICU, because we all understand that most important step to prevent infection is being bare below elbow and strict hand washing and hand hygiene. And there is no role of scrubbings. The second question is about evidence on dryers. So, do you know
Yes.
the answer, Bhushan? You want to attempt?
No, we should not use dryers. So dryers are not recommended. Uh, uh, so we
Uh,
should use clean. If at all we need, so we should use uh, like tissue paper, which is clean, or autoclave clothes. We can use.
So, why do you say that? So, do you know anything about the evidence with regards to use of dryers in NICU? Have you read any articles?
No, ma'am. Not
So,
exactly. No.
yeah, there has been recently, there has been one article published in Journal of Clinical Neonatology, and basically, what it says that yes, hand dryers are effective and useful, but again, there are few questions with regards to number one, the cost. Number two is the time which is required. Because for drying your hands under the hair dryer, you will need at least 45 to 60 seconds. Third thing is, the safety of using hair dryer, using the hand dryers, and then they can make certain noises. So all these things, because of these factors, and we know that we live in a developing country and sometimes resource limited settings. So yes, hand dryers are useful, but again, there are various articles on that, and the what I understand is, if we can, what is most important is thoroughly wash your hand, and then we need to make sure that those hands which are washed properly should not get contaminated by using inappropriate drying methods. As long as we use either autoclaved towels which are only single use, or those disposable paper towels, it is fine. But hand dryers can be used, but there are a few articles, so you can go through those articles. If I get time, I will try and post those over here in chat box.
Okay.
Okay. Then another question with regards to if injection vial is opened, then how long can it be reused? What do you want to say,
Should,
Bhushan, on that?
usually we should use a single use vial actually. We should not
Yes.
reuse in most instances we should use only a single use vial. But if at
True.
all there is a need, so always prefer to have a unit policy is very much, ma'am, because which kind of drug they are using, what concentration, and how long they need to use it. Uh, that is also a question. So for specific which drug they are asking is
I
also
think
important. So for which injection, like if they're asking if they're asking about like albumin or a surfactant or like things like that, we should always prefer to use a single drug. If in case of antibiotics, I think the vial itself mentioned that after reconstitution, the time is mentioned on the uh, instruction box for every antibiotic. It is mentioned.
yeah, you're right. But I think still I would say try let us first join the next link, and then we can
Okay.
discuss this. I want to say a few things on that. Yeah. Okay. We all should join the
Okay.
second link.
Okay.